Hi, I'm Richard Jacobson, board-certified orthodontist, faculty UCLA 30 years private practice here in the Pacific Palisades, where I'm director of Face Center LA. Can snoring and sleep apnea in children be prevented? Fortunately for all of us, the answer is a resounding yes. In addition to going to your pediatrician and making certain that the tonsils and the adenoids are not causing the blockage, orthodontists that are trained in sleep medicine and cephalometrics can measure to see if there is any skeletal disparities. And if there are, there's simple appliances that can be placed to normalize that. For example, an appliance called a palatal distraction appliance. It's custom made and fitted into the child's mouth so that it's comfortably and easily tolerated. It has a little expansion screw where the mid-palatal suture is gently distracted, creating room for all of the teeth, and very gently over a period of a few months, distracted sufficiently to allow a normal airway.